Once again, my gratitude really to Felix for this invitation, and Peter Lange is another person. I wish him well. We go back a long way, for many, many years now, and it's always a pleasure to come to this symposium. I covered venous valve yesterday in great detail, and so I was asked to talk about other valves that are available, and so I focused predominantly on the Pulsta valve, and then a couple of others that are either in the pipeline or may not be. So for this Pulsta valve, I'm grateful to Ji Byom Kim in Seoul, South Korea, for the data, because he's done the bulk of the work. I've helped review the paper and helped to get it published. So I've had a little bit of input, but obviously I do not take any credit for all the hard work that Ji Byom Kim and his team have put in. And whether they continue or not really depends on Kim Jong-un and Donald Trump, doesn't it, really? So I hope that between them, they don't destroy South Korea and all the other potential research that is coming out of there. So we've discussed some of these valves that are either available or are being attempted or undergoing study. So Harmony valve, Lee has given you a very nice detail about the size of that and the shape of that. Venous P valve, I thought I gave an outstanding talk yesterday about the venous P valve and the sizes that are available, up to 36 millimeters. And the Pulsta valve, and notice to some extent the similarities of shape. There's not too much difference between the Harmony and the venous valve in terms of the flares, the straight part, and the flare in the right ventricular outflow tract. But notice the Pulsta valve, which has got actually a very small flare in comparison with these other valves. And that slight change from the ones we're using. At the moment, the Pulsta valve is available between 18 and 28 millimeters, and the delivery system is 18 French. And this is a knitted nitinol wire stent with tri-leaflet porcine pericardial valve tissue inside it. And this was the first sheep who had the privilege and honor to receive the Pulsta valve in 2011. This was a 6-month-old, and at a 3-month study, when the valve was taken out, it showed pretty much full endothelialization in that study. And then subsequently, Ji Byom Kim published this paper of theirs on this experimental animal study of the what wasn't called Pulsta valve at that time, but in 2014, and subsequently they've carried on with the work. The delivery system is pretty similar in principle to all these other valves, with a delivery catheter, a hook to attach the valve, a handle to rotate and uncover the valve, and the assembly here with a nose cone or carrot, and a covering here, which is then exposed by rotating this handle. The crimping is pretty standard or similar to all these other valves as well, so there's nothing new about that. And then the sizes that are available of the Pulsta valve are 18, 20, 22, going up to 28 millimeters. The diameter, interestingly, is only 4 millimeters larger than the diameter of the straight part. So these are much smaller flares than either the venous or the Harmony valve. The expansion force, obviously the smaller the diameter of the valve, the greater the expansion force, and so as it gets bigger, it reduces. The compression force response is pretty much fairly standard and similar in all of these. But just notice, and I keep emphasizing this, about the flares that are much smaller, both proximally and distally, compared with the venous and the harmony. So the device was approved by the Korean FDA in December 2014 and received IRB approval in June 2015. And so the timeline was patients more than 19 years of age were approved for receiving these, and that was in July 2015. And then the indication was extended by and approved by the Korean FDA, and that was age more than 10 years and weight more than 30 kilograms in July last year. And so a feasibility study was started just over a year ago now, and had to include 10 patients. The primary outcome was procedure success, procedural or device-related serious adverse events at 6 months, and hemodynamic functional improvement rate at 6 months as well. The first patient who received the Pulsta valve was in February 2016. This was a female 20-year-old with tetralogy of Fallot who'd had 2 previous open heart operations, and one was at 2 months of age and one at 14 years of age. At 14 years, the pulmonary valve was repaired for severe pulmonary regurgitation, and the patient at the time was in New York Heart Association class 3. Before the procedure, this patient had severe pulmonary regurgitant fraction of 38%. The right ventricle was dilated at 182 mils per meter squared, and the ejection fraction was 51%, and you can see the MRI study on that. And then this is some clips of deployment of the Pulsta valve. It's not easy to see, I think, with the lighting as it is, but I think you can just about make out that there is a internal jugular vein catheter just for check angiograms, and then from the femoral vein, a guide wire is positioned in the left lower lobe pulmonary artery, and there's the distal flare of the Pulsta valve exposed, and then in the right, more of the valves exposed, and there is the valve fully deployed. Now, currently the difference in selection is that the patients really have to have, there's obviously a size limit, but there isn't the massively dilated main pulmonary artery towards the bifurcation or massively dilated right ventricular outflow tract, and the main pulmonary artery needs to be relatively short in order to deploy the valve just before the bifurcation and just at where the native pulmonary valve might be. And so this is just slightly a different difference in concept compared with these other valves. And here you see 3D transesophageal echo showing excellent movement of the Pulsta valve, and the main pulmonary angiogram here showing a competent Pulsta valve as well. The first in human experience was reported in CCI in February of this year for this valve by Ji Byung Kim. And then there are some other pictures of this was their third patient, who was a 26-year-old in whom a regurgitant fraction was 39%, end diastolic volume massively increased at 205 mils per meter squared. There was interrupted inferior vena cava, so the valve was deployed with a guide wire positioned in the right lower lobe pulmonary artery, and the valve was deployed from the right internal jugular venous approach. There's the check angiogram to show the positioning of the positioning of the Pulsta valve, and then again, it's a little bit fuzzy, isn't it? The valve being deployed fully once the check angiograms are done, and here it's about to be released. Maybe not. Yeah, okay, well, that's not very good. In one of the patients, this was a 13-year-old, they had some concerns about the left coronary artery being very close to the target vessel, and obviously in that sort of situation, if pre-stenting is likely to put that coronary artery at risk. Here, the distance was only about 1 millimeter, but after their intense sort of assessment, they decided to go ahead with Pulsta valve implantation, and then afterwards showed that the left coronary artery was not really compromised at all. And that says something about the radial force of the Pulsta valve, which is not really massively expansile, so there isn't a very strong radial force to compress the coronary artery. So up to now, the studies consisted of 10 patients, age range from 13 to 36 years, weight range from 39 to 68 kilograms, and diastolic volume of the right ventricle gone from between 160 and 210, regurgitant fraction between 35 and 56%. More importantly, at the moment, you see the limitation perhaps, and that is the annulus size of between 22 to 25 millimeters. And remember, the largest valve currently is 28 millimeters, and we have to oversize by about 2 to 3 millimeters in comparison. So the size range is the one that in the West we have alternatives to, valves to this, such as the Melody and the Sapient. Procedure times fairly standard. The follow-up MRI in these patients has shown what we've all come to expect, and that is considerable reduction at 6 months in the right ventricular end diastolic volume. And so based on their study, this is a interesting and another addition. Feasibility study has been completed in October last year. The short-term 6-month follow-up results are good. There have been no adverse events, and a multi-center study is going to start or has started in South Korea. The Korean FDA really insisted on a study that was initially initially investigator-initiated, so clinicians wanted to use it and got approval on a compassionate use basis, but the Korean FDA has now insisted that it should be a proper sponsor-initiated study planned for 5 centers with 3 patients per center, completing the study in 15 patients and then applying for a Korean FDA approval. Now, the other valve, and I'm grateful to Larry Meng and John Cheetham for these slides, and this is currently the valve is called Beijing Med Zenith PT valve. Again, the design is familiar, isn't it? The shape and the size. I could give it a different name and you would be none the wiser. It's a self-expanding stent, nitinol frame with porcine pericardium. The valve sizes currently for this are 20, 23, and 26. There are 5 dimensions for the width and the length of the straight part that are being used or will be used. The delivery system is slightly different from the others and is 21 French, but it still has that concept of a controlled release handle. And here are some examples or still pictures of the valve being compressed and then gradually being released until it's fully deployed. So that's just demonstrating the release mechanism. And in 6 lambs, the valve has been implanted. This was between November 2015 and February 2016. 4 of them received a 20 millimeter valve, 1 23 and 1 26 millimeter. And here's some angiograms of the 26 millimeter Beijing valve being deployed. Here you see the valve in position with check angiograms. There's the distal flare exposed, and then gradually the central straight part is exposed, and then eventually the proximal flare is deployed and the valve released. And there it is. And there's the check angiograms showing a competent looking pulmonary valve. So The valve was implanted successfully, followed up for 6 months. There was no device-related morbidity or mortality. There was no significant pulmonary regurgitation. 1 out of the 6 had a very small paravalvular leak, and there was variable, very small paravalvular leak around the right ventricular outflow tract in 4 out of 6, but not significant. And so their conclusion was that the valve could be safely implanted. Competent valve was implanted with excellent results at up to 6 months. There was a smooth tissue layer covering the stent and the valve leaflets, and there was no evidence of endocarditis or thrombus formation on the valve leaflets. And so the next steps for that valve are modifying the delivery system in order to make it a little bit more soft and hydrophilic, have a really efficient crimper to load the valve very quickly, because the loading is a problem with the venous as well as this valve. And then adding another design, frame design for shorter length and larger diameter. And then the plan is, after getting Chinese FDA approval, to have a clinical trial in 4 or 5 centers and aiming for about 100 patients in China. And then sometime in 2018, the plan is for a CE study as well as a study in South America. So that's gives you a little bit of flavor of what might be on the horizon the next year. And just as an add-on, as the final slide, this is a valve that was developed by Vascular Innovation company in Thailand. And this company is involved in ASDs and VSD and PDA devices, cocoon devices. So they produced this valve, which was used for the first time in Hanoi by here, standing in the middle here. This was a straight design valve, and it was used in March 2012. I don't have any moving pictures, but the result was excellent. But the company seemed to have stopped this project for their own financial reasons, I guess. So I'll stop there. That gives you just a little summary of other valves that are potentially in the pipeline, and if you keep an eye out for these in the next year or two, we'll have more information available. Thank you very much for your attention.